At Mutuini Hospital, parents streamed in with their little ones, telling a story of fear, love and hope. Fear of disease, love for their children, and hope that these small vials of vaccine will keep deadly infections at bay.
The vaccine is inactive. That is what people need to understand. Yeah. So the measles as it is, yes, it's an antigen, it's a virus, but it is inactive. Okay. So it cannot cause a major disease. It's very inactive. So once it's introduced in the body, now your body responds by producing antibodies. So that in later date, if you get a disease like measles, now the body will remember that it already created some antibodies against this disease. So the body will fight back and protect itself from a major disease of the same.
Watu wanapata maradhi ya homa ya utumbo mara kwa mara, anaendelea kutumia moxil mara kwa mara, alafu sasa mwili inakuwa nini? Resistant kwa ile dawa.
Now, many parents were initially hesitant about the typhoid vaccine, a new addition for many of them.
Okay, wazazi wengi walikuwa wanauliza kwa nini hizi immunizations zimekuwa nyingi, kwa nini na ni kwa nini tunajaribu tunawapatia sindano mingi mara moja. Kwa kawaida hatujapeana sindano kwa mara moja wakati wa campaign, tumekuwa tukipeana moja. Kwa hivyo resistance ilikuwa kutokana inakuwa kwa sababu tunapeana sindano mbili kwa pamoja, but tukiendelea educate na kuwahimiza, the uptake now is good.
For these kids, the small ones, they are supposed to be vaccinated because they can just eat anything without even cleaning their hands.
Typhoid is a bacterial infection spread through contaminated food and water, causing prolonged fever, abdominal pain, and if untreated, even death.
Tuseme kama maji unajua tunatumia zile za kuchimbwa.
So typhoid is a disease that is caused by Salmonella typhi, a bacteria that is found in contaminated water. Once you're vaccinated, your body creates antibodies towards the Salmonella typhi bacteria.
Kwa watoto wa chini ya miaka 15, 1% hadi 4% ambao wanapata na homa ya utumbo huwa wanafariki. Ukiangalia watoto wenye miaka zaidi ya 4 hadi 15, pia unapata 6% hadi 10% pia wanafariki. Hizo ni takwimu kutoka kwenye WHO.
The campaign also targeted measles and rubella, both viral infections. Measles attacks the respiratory system, causing fever, rash, and can lead to pneumonia, brain swelling, and even death. Rubella, though milder, is dangerous for unborn babies when pregnant mothers are infected.
Measles, we have conjunctivitis. Conjunctivitis is the redness of the eyes. We have generalized rash for the measles. We also have fever. And now, for the rubella now, the only difference is for rubella, the rash is behind the ears. You understand? That's why the rubella is being called German measles. So, and the other one is just measles. Okay. So the difference is, rubella we have a rash behind the eyes, behind the ears. Sawa sawa. So that's the major difference. And of course the difference can also be due to, we can do the diagnosis. That's why now you classify that this is measles virus and this one is the rubella virus. But the presentation, basically, it's the same.
At Mutuini, health workers detected 4 measles cases during the drive. Children with symptoms were screened and not vaccinated to prevent adverse reactions.
If a child comes in with measles, we don't give the vaccine, the measles rubella vaccine. We isolate the child, and basically treatment for measles, there is no definite treatment for measles. We just do management of the signs and symptoms, because most of those symptoms can later be complicated to other diseases like pneumonia, meningitis, encephalitis.
The Ministry of Health now plans to incorporate the typhoid vaccine into Kenya's routine immunization schedule, a move that could protect millions more in coming years.
Kwa kawaida inakuanga kwa private hospitals, but kwa public inataka kuwa introduced. Imekuwa ikipeanwa kwa watu wazima wanaposafiri sana.
And as the campaign comes to a close today, health workers urge parents to embrace vaccination. For diseases know no borders, and prevention remains the only sure shield.
because most of the time the parents may not know that the child has measles. So when we are doing the vaccination, we are checking whether the baby or the child has signs and symptoms of measles.
Reporting for K24 TV, my name is Robbie Omondi.